I think it's unethical how the media portrays nurses. It's unfair that they go get an education and get portrayed as someone who is just a mere worker at a hospital or clinic, or are seen as a sex object in TV shows and movies. They don't get the recognition they deserve and work so hard to get. A couple years ago, I wanted to be a nurse, but when I saw the hard work nurses did and the portrayal the media had, I didn't think it was right to be a nurse. I wouldn't feel right trying to be professional when TV shows and the media told viewers otherwise.
A nurse is a professional that it's trained to take care of a patient or communities and help on those with medical assistance. And our responsibility is to help them, assist them, and any information that is related to us or given to us to communicate with the physician.
Nurses are duty-bound to treat patients as if they were the family members of the nurse. That's how you're supposed to treat your patients.
They're important to doctors because they're really helpful. They do the little things like check heartbeats. They also give medicine with the needle and take out blood, and if done incorrectly, it could be lethal. Also, what they learn and what they know is very important.
I think the media does not portray the nurses well because when I am watching shows that incorporate nurses, they are portrayed as weak, dramatic, and careless figures. So they are portrayed as people who are just into the gossip and the drama and don't really focus on their jobs or show that they care about their job.
Poorly. Like I had mentioned before, they portray him as, and it's just a person that, an individual that stands by the physician, and pretty much they give the credit to the physician, which pretty much they do a lot, but we're the ones that are taking care of the patient and anything that the patient may need, any medical assistance, and we communicate, the patients communicate with us. Sometimes they will not feel more comfortable explaining to the doctor, but we're the ones that will be able to give that communication between patient, nurse, and doctor.
People don't think nurses have anything of value to say. They get that idea from television and other media that relentlessly tells the public that nursing is meaningless scut work for losers, that any modern day professional who has an interest in health becomes a physician.
I think a nurse should dress with scrubs that are comfortable and fit for the job. Appearance should not be something that interferes with the nurse's job. Scrubs are good because that makes them look professional and easy to recognize.
The most popular shows, Grey's Anatomy, House, Private Practice, they regularly send negative messages about nursing to the public, that nurses don't do anything of value, that physicians do all the work that nurses do in real life.
Grey's Anatomy is one of them. The reason is they make it seem like nurses don't do anything, they just mingle with staff, they socialize, talk about their personal lives, versus showing the productivity of a daily basis that a nurse will do. And that's one thing that I disagree. They should be focused more, giving an example, especially to all the viewers and to the society, that what an actual nurse does. Have contact with patients and assist the physicians and help them roll out any diagnosis that a patient might have.
No, I think the nurses on TV shows and movies have less responsibilities than those we see in clinics and hospitals. On shows and movies, they are seen doing simple tasks and they are more involved in the drama that goes around their environment rather than the tasks they are doing. They aren't kept busy like the nurses I see in person. The ones I see are either helping a patient, doctor, or they're doing paperwork that involves their job.
They should focus more on how well the patients are being taken care of and how we do communicate with them, and we most likely care and very compassionate for the patients versus mingling with staff or communicating our personal lives to them. That's what social media they have, or those shows have shown in the past.
So what we need to do is reach out to the media to try to get them to portray nurses more accurately, because the images of nurses that are out there right now are largely negative. So we must educate the public about what nurses really do to save lives and improve patient outcomes, so that we can be a stronger profession, so that we can provide better care for our patients, and we can save more lives. Media images that they see every day on television that tells people that nursing care is really about this basic serving of physicians' work, this unskilled labor that doesn't require a brain. Yet, as anyone who's ever been to nursing school can tell you, nursing school is very difficult, and we deserve credit for the education that we work so hard to get.
Women used to dress like that about 50 years ago, 40 years ago. There were some nurses out there who went into the profession just to marry a doctor. Were they a little bit more provocative? Possibly.
That's it. You're fired. Leave now.
And what about us?
We're through.
Okay, so sorry it didn't work out. But thanks for letting me sleep with you. And thanks for letting me work here at Sisters of Mercy Hospital.
Show me where it hurts.
Warning, please limit wearing of Tag body spray in hospital settings. Failure to do so may result in an outbreak of highly contagious lusty nurse fever. Ouch. Introducing Tag body spray for guys.
Ultra Bright gets you noticed. Take Nurse Jackie M. She'd been on Dr. Phil W.'s case for months, but to Dr. Phil, Jackie was a blank X-ray. Then she discovered Ultra Bright White, Dynamite Fresh. It got Jackie noticed. The next day, Phil examined Jackie's smile. The rest is semi-private. Put Ultra Bright toothpaste on your case for a smile so white and breath so fresh, it'll get you.
So, I would not feel safe with her handling my health stuff. I mean, I wouldn't mind her, like, afterwards. Yeah, that's fine, but just not when my life is on the line or anything. So, I feel like you'd see her in more, like, maybe some movies, maybe adult movies. You wouldn't really see her on, like, serious shows like House or anything, because obviously, like, real-life nurses don't walk around like this. Well, at least not where I've been. I need to find where they do walk around like this, but not here. She has her badge, she has her pen, she has her notebook. She's ready to take notes and ask me questions about my health and stuff. She has a smile on her face and the proper stuff to be wearing, some scrubs. Like, you know, she's doing her job. I think this is an accurate portrayal of what nurses look like. They all get the job done and keep us healthy and safe and stuff.
It is true that nurses used to dress provocatively just to marry a doctor or be with a doctor, but not all nurses are like that. The media keeps telling viewers that nurses aren't really available and anyone without training can take their position. Instead, the media should try explaining and try giving examples of what a nurse is really like. A professional who works hard to keep patients healthy. That is their main goal. That is what nurses really do. And I think that that's what the media should really show, the reality of what a nurse is.